A warm welcome to everyone this morning. Good morning, and thank you for joining us here today. I'm Radha Muthiah, and I'm the Executive Director of the Global Alliance for Clean Cookstoves. I'd like to welcome our esteemed panelists who are here with us today, and will share with you some really important commentary with us, building upon some brief introductory remarks that I'd like to make this morning. I'd also like to thank the National Press Club for hosting this event here for us today. The Global Burden of Disease study was released in the Lancet this past Thursday. The first GBD estimates were ones that were orchestrated by the World Bank in the mid-1990s. In fact, I remember there's a lot of discussion about that period about, could such an ambitious undertaking be something that we would really embark on at that point in time to identify diseases and the related contributing factors that were responsible for global mortality. It seemed implausible at the time to many that it could be pulled off, but now we've come to rely on these GBD estimates to update us with critical data that informs us on public health policy worldwide, highlights those critical areas that the global health community should really be focusing its resources and advocacy on. Now the study is much, much more comprehensive. Many more disabilities, diseases, and risk factors that have been looked at. In this 2010 update, the primary supporting organization is actually the Bill and Melinda Gates Foundation. We have almost 500 scientists from 50 different countries around the world who've contributed to the various research studies that were pulled together in this report that the University of Washington's Institute for Health Metrics and Evaluation convened. That's a really impressive collaboration across public, academic, nonprofit communities around the world. Now, I have to say, having looked at the Lancet study broadly, there's really some very good news for us to celebrate within there. We see a few things that I'd like to highlight. One is a 10-year increase in the average life expectancy as compared to the numbers that we had in 1990. A reduction in mortality rates, particularly for those under the age of 5, and better access to food, improved sanitation, and medical care. So those are some good things for us to celebrate for sure that have come out in this recent study. But there were some surprises. One of them was the increase in mortality of young adults in particular. And the reason we're gathered here today, household air pollution from cooking smoke, representing the #1 contribution to environmental health-related deaths around the world. 4 million people are estimated to die every year burning solid fuels for seemingly the simple act of cooking. What strikes me is the Global Burden of Disease study estimates that after high blood pressure, alcohol, and tobacco, household air pollution is the largest health risk factor. Now, I won't go into it more. We've got an esteemed panel here who will be able to give you some great analysis, and I know that Professor Kirk Smith has really summarized a lot of it with us that's actually also available on our website for you to take a look at as well. But this news comes at a particularly important time for the global health community as we near the end of the Millennium Development Goals. The MDGs themselves were critical and important, in particular in 3 specific ways. They set a moral and political commitment from world leaders as to how we would jointly tackle issues related to development. It provided us with a platform and a framework for coherently sort of thinking through these long-term issues of global health and the related areas for overall international development. And it provided real clarity for advocacy on each of these issues. But we do need to remember, and I think this is what GBD tells us, that there's an unfinished agenda here. Millions of young children are still dying from preventable disease, and less well-known risk factors like household air pollution are taking a devastating impact on human health and environmental sustainability. We at the Alliance and our partners have always believed that the time indeed is right, and the time is actually now to be able to act on this issue for access to clean, safe, efficient, affordable cooking solutions, whether they're cleaner fuels, cleaner stoves, or heat retention devices, the entire cooking solution spectrum. And this recent estimate from the Global Burden of Disease only further reinforces our firm belief that cooking shouldn't kill. Since its launching in 2010, the Alliance has been engaged in a number of different activities to help improve lives, improve livelihoods, save lives, empower women, and preserve the environment by creating a global market for clean cookstoves and fuels, including a few areas that I'd like to highlight now. The first area that the Alliance really engaged in any substantive way was to support research efforts, and in particular health research efforts, to show hopefully to show that there is this strong correlation between improved fuels, cleaner fuels, improved stoves, and better health outcomes, especially for young children. We've also engaged in research in climate, in livelihood impacts, and gender best practices. We've been working closely with the Partnership for Clean Indoor Air at EPA to help develop clean cook stove standards, and we're now working with the ISO body to help ensure that the guidelines that we have move towards standards for globally. We've been trying to raise grant resources and increase investor interest to bring financing into the sector to really catalyze the market for clean cook stoves and fuels. We do know that if we want people to adopt cleaner fuels and stoves sustainably, the availability of those stoves has to be there as well. And we continue to enlist world leaders and international celebrities to help tell the cook stove story and tell the household air pollution story, as it's one that unfortunately is not as well known as it should be. So the Global Burden Disease Study of 2010, with its estimation that household air pollution deaths are double what we previously knew, only redoubles our own efforts at the Alliance to be able to address this issue and to ensure that our goal of 100 million households adopting clean and efficient fuels and stoves by the year 2020 is reached. We at the Alliance hope to work with each of you and your partners to be able to pursue this endeavor and to be able to reach our goals and to ensure that we can solve this wide-scale issue once and for all. So let me stop here and introduce our moderator for today, Thomas Boyke, a senior fellow for global health, economics, and development at the Council on Foreign Relations. He's also adjunct professor of law at Georgetown University and a consultant to the Bill and Melinda Gates Foundation. Mr. Boyke's work, research, and writing focus on trade, legal, and regulatory issues in global health and development, and in particular tobacco and non-communicable diseases, technology innovation and delivery, clinical trials, and import safety. We're very honored that he's here and able to join us today. So with that, let me turn it over to Tom to introduce our panel and to begin our conversation. Tom, thank you very much.